Cancer is wrongly linked to the fact that if someone gets this disease, it will mean imminent death.
When I hear that someone has a tumor or cancer, I panic.
There are some people who think it is contagious. There are others who think it will certainly and inevitably cause death.
Psychologically and socially speaking, the word cancer is directly linked to death. And this is neither scientific nor correct.
The misconception about cancer is highly emphasized, especially amongst women, by the fact of the high mortality rate in breast cancer patients. And this is not due to the unavailability or ineffectiveness of treatment, but rather that most cases arrive late and seek therapy at very late stages of the disease. And the records show that 70% of breast cancer cases in the Kingdom of Saudi Arabia are diagnosed at advanced stages.
Cancer leads to death when discovered late. The cases will be badly developed then. And this is why we call on women for early checkups. Breast cancer makes up 22% of all tumors, and it ranks as #1 in cancer cases in women. And what makes it really dangerous is that 2/3 of the patients arrive with very advanced stages.
One of the most concerning facts the records reveal in the kingdom is the number of young Saudi women ill with breast cancer, which falls 5 times higher than in other advanced countries, calling for great concern and grief amongst Saudi medical and health bodies.
Today I'm your mirror, okay? First, I want you to sit.
Breast examination is a highly sensitive issue in many conservative societies, where women and guardians alike would refuse an early mammogram if conducted by a male physician, keeping in mind that female radiologists are a rarity, even on a worldwide scale. And it is here that a religious misconception occurs which allows for this test to be conducted by a male physician due to the unavailability of a female doctor.
Unfortunately, when we tell people that a mammogram should be conducted annually, women say that they do not feel any pain that necessitates a mammogram. My reply to this is that it's called malignant tumors, and it develops with no initial apparent symptoms. Some people may also say that a mammogram increases the chances for breast cancer. I state here that the countries where women take annual mammograms saw a huge drop in breast cancer fatalities, reaching as low as 46% in Sweden and about 23% in the United States of America. So how can people say that mammograms cause cancer? This is totally untrue propaganda.
I felt some pain in my breast, so I went back and examined myself, and I felt there was a round mass moving under my palm. And it was moving where my fingers moved.
I guess I was examining my breast by pressing with my hand. And I felt a mass, a hard mass in my breast, but it never occurred to me that this could be cancer.
I felt my breast and I found something hard, up by the breast. I did not think it was anything. I felt some pain from pressing down on it, and so I prayed some.
Some women who have breast cancer refuse to take the needed tests. Moreover, some of them refuse proper medical treatment, whether surgical or as chemotherapy. And some women see that praying is more than enough medicine for their cases, while others turn to alternative medicine of herbs, resulting in loss of vital time, then returning to proper medicine after the disease has developed and reached a limit beyond cure.
Our problem in the kingdom is not in the services. It is that our patients do not come early enough, nor in the right time. This is the problem.
This problem complicates and turns into a grave situation where most of the breast cancer cases arrive for treatment at their last stages, putting the patients and their families under tremendous pressures because of the elongated and demanding treatment course of the most severe and advanced breast cancer cases, and because of the need to remove the breast, a most feminine characteristic of a woman.
When I went in to see the doctor, he tried to calm me down, but I heard him looking for a surgeon. And if a surgeon is needed, then removal is considered. So I said, "Doctor, tell me the fact. I understand. I am in the field."
Well, do all patients need to have a surgical procedure to remove the breast? The answer is no, most of them should not. In fact, 100% of them should not, provided they come early enough for checkups and treatment.
In all advanced cases where surgical procedure is needed to remove the breast to prevent the spread of the disease, a course of intensive chemotherapy usually follows to eradicate the remainder of any tumor and also to prevent any future recurrences. Also in this stage, there is much misconception amongst women regarding medical treatment, mainly chemotherapy. It seems what is previously known about the side effects of chemotherapy of hair loss and severe nausea as the chief reason for women to refuse the chemotherapy.
With no doubt, chemotherapy was very tiring to patients in the past because of the lack of remedies directed at the side effects of the treatment. These side effects are serious and do affect the patient's lifestyle, which mainly are nausea and vomiting. Nowadays, these advanced remedies are used very effectively, and the symptoms of the side effects have been reduced by up to 90%.
Chemotherapy, which is generally linked to cancer treatment and to breast cancer treatment in particular, represents a threat of losing the hair, which is yet another feminine characteristic of a woman. Using hormones is another weapon in the treatment of breast cancer.
Hormones are a two-edged sword. Their use can cause cancer, but at the same time, it could cure it.
Here, at the King Abdulaziz University Hospital, some of the best medical services for cancer surgery are provided, and for the treatment of breast cancer in particular.
Medical treatment at the university hospital is very advanced and diverse. Praise be to Allah. Including surgical procedures, the hospital also takes charge in spreading awareness regarding breast cancer diagnosis, prevention, and treatment amongst women all over the country.
A husband must feel with his wife, stand by her, encourage her, support her, and boost her morale, not run away or abandon her. If her breast is removed or she is dismembered for any reason, it is not the end of the world. On the contrary, the husband should steadfastly stand by her side, give his utmost support morally, financially, and others.
We do not want the woman to wait until she feels the mass in her breast. We want her to take a mammogram regularly to discover any irregularities before they become apparent.